Thanks for inviting us in tonight. Pfizer's vaccine for kids between the age of 5 and 11 could get emergency approval in just a couple of weeks. And today, the White House unveiled their plan to distribute as many doses as possible once that shot gets the green light. So tonight at 11, we want to dig into how this version of the vaccine differs from what adults are getting. We've got the impact this could have on schools and how local and U.S. health leaders are preparing to put shots in young arms.
Let's break down this nationwide rollout by the numbers. 15 million doses are expected to ship out within the first week of full approval. This also includes shipments of smaller needles for younger patients. Right now, the country has enough supplies of the Pfizer shot to vaccinate roughly 28 million kids. Keep in mind, this version for kids 5 to 11 is a smaller dose. Our Verify team talked to the experts and found it is still a 2-dose series, but kids get a third of the dosage that's given to adults. Specifically, they'll get 10 micrograms instead of 30.
Now, we know 25,000 pediatricians and doctors' offices across the country have already signed up to receive those Pfizer doses once they're made available. So what's the plan here at home? Tonight, our Emily Longnecker sat down with local doctors to see what they're expecting.
It's not a question of if, but when and how many doses of the vaccine will be available to kids who have pediatricians through IU Health. But top doctors here at Riley Hospital for Children say undoubtedly some of that vaccine will also wind up here.
For vaccine programs to work and work effectively, you definitely have to get it to all the primary care physicians because they're the ones who are seeing the children.
And even though the vaccine hasn't arrived yet, Dr. John Christensen, a pediatric infectious disease expert with Riley Hospital for Children, says parents are already asking about it.
One of the top number one kind of concern that all parents have with their children is the vaccine going to cause any harm?
The other question, says Dr. Christensen, is does my child really need this?
Nobody wants to see their child get an injection that may be painful, but the reality that people need to realize is that that these vaccines are effective and that they are safe. There's a lot of misinformation about some of the side effects that may come from the vaccine, like infertility, and there's no evidence of any of that.
Dr. Christensen says he's seen children of all ages hospitalized for COVID, some in Riley's intensive care unit. According to the Regent Street Institute, working with the state to track data of hospitalizations from COVID, 1,766 kids ages 0 through 19 have been hospitalized from COVID since March 1st, 2020 to October 18th, 2021. The number of deaths for that same age range is 19. Dr. Christensen says now is not the time to let down your guard.
This is the time to, rev up vaccination. This is the time to protect yourself because it will keep people from dying and getting hospitalized.
We also wanted to know how this vaccine rollout could potentially impact our local schools. We reached out to IPS, who told us they haven't made any decisions just yet, but they are following the State Health Department, CDC, and Marion County Health recommendations. And also noted the vaccine is, quote, the best chance we have to move past the pandemic. We've also heard from school nurses in the past weeks, and they say the shot for young Hoosiers could really be a game changer when it comes to all the contact tracing that they have on their plates right now.
I do think it will decrease the amount of days absent that kids would have.
The latest state guidance for vaccinated students suggests no quarantine necessary for close contacts as long as they don't have symptoms. We have a full breakdown of the recommendations and also the rollout plan for this next round of vaccinations. All you have to do is open up the WTHR app. And that's a wrap of tonight's big story.